I'm Paurvi Bhatt, and I am the founder CEO of Third Eye Focus, and I specifically focus on ensuring we have better financing for access to care. Social connection is something that we're hearing so much more about, and the need to advance it, not only in the specific community that any of us is in where we live, but also in our field is crucial. And the reason why is we're seeing how much being disconnected is really getting in the way of our well-being and the things that we're really trying to achieve. And said differently, we know that when we are connected, we feel better, we do better, we trust more, we speak up more, and we engage and are here, frankly, for connecting. And so how I advance it specifically isn't one in doing exactly what I just did now, is make sure people understand and appreciate it's not something that's just part of our ethos. It is something that we have to elevate now and make it much more visible that connecting matters. And specifically, since my background is in measurement and financing, is to make it clear as to how much is it helping and how much is not connecting, hurting us, and making sure we measure that not only for its own sake, but also measure it for the sake of the other issues that matter so much for us today. So the way I advance it is twofold: bring it up, make sure that there's a clean example on why it matters, and then sort through how can we better measure it so that we can bring more money and more services to those who are disconnected. I'll admit, I'm an only child. I'm a deep introvert. I am a child of an immigrant. And so I'm used to being on the outside. Not that I loved it, but I'm used to it. So it's taken me a minute to realize how important elevating being connected is. And one of the things that I've learned, especially at a time when we're doing so much remotely and how important technology has become for us, is sometimes we're swapping out being connected under the guise of, well, tech will take care of it. And I'm learning that bringing that up more is helping. Tech has a really important spot in our advancements. It always has. We would be where we are today if we weren't leaning on new discoveries and innovation. But the era we're in right now requires us to pause and really think through what are we trading when we do it. So one of the big things that I've been mentioning and thinking through is a lot of what is happening now, whether it's AI or any other form of technology, even remote, you're looking at me and engaging with me remotely today, is that it's more efficient. And I started to think about that because I measure things and I translate them in actionable ways so that a system can change. So the whole value proposition of a lot of this is that if it's more efficient, it means we've saved time. And time is a finite resource. So where did the time go? Who got it? How is it being used? And when we think about it more deeply, I bet most of us, and I spend a lot of time on care brought closer to home, right? And there's so much in the health industry that's saying, let's monitor so much of this, right? And we have monitoring technology, we have video cameras, we have so much that we can make sure if you're at home and you're older or you're recovering from something, we can equip your home so that you can stay home. The thing is, most of us who need care or are caring people, we want that in real life. And the monitoring part is helpful so that we don't feel like we're a burden. But the essence of what care is the touch, the feel, the look of care. And that is in real life. So if we're saying that all of this technology is saving time, we would have thought that that time would have been redirected so that we could spend in real life time together. And yet we're finding we're the most distant connected than we've ever been. So that to me is opening up a tough conversation of why are we having a hard time being in real life with each other? Because then we would redirect that time to be together. And that I think is something that was surprising in kind of really analyzing information and recognizing what's going on. And in recognizing that while workforces are starting to say remote work, we've got to balance that. People need to be in real life at work. That same conversation isn't happening at home about how to be in real life, in real connection, in the caring spaces that we need at home. And whether it's professionals and community and family, however defined. So those for me are really important distinctions and things that we could be asking in our work. The final thing that I've been surprised by, and I'll admit a little guilty that I didn't do, is I've been a leader inside of a lot of social and healthcare, and I didn't ask the question while decisions were being made, would this work for me? If whatever the decision was, and especially around things that are oriented on whether people can travel to be in a certain place for work or can stay back because of what they may need at home, whether that be an employee benefit or an actual designed service. And it's been a really important learning to drop the curtain across lived experience and professional experience and bring the two together. And while we're in an era of storytelling and it's almost an unrequited need to tell our story, it's beautiful to do it. But at the end, we're all trained in something and we're all sitting in rooms where people are listening. How do we drop the curtain? Yes, talk about your own lived experience, but immediately bring your own trained experience and leadership seat together and make the next best decision, or at least ask the next important question around how do we stay connected in when we come together. I've had a global career, which meant it was faxes and phone calls with a lot of colleagues that eventually became really good, close, trusted friends. But in the world we're in now, we are not limited only to those things to try and come together. But then at the end of the day, how do we use our time together was one of the biggest things that I think is going to be the future, is where is this fixed asset called time being redirected so that it's its highest and best use. You know, the hope for the future is really, for me, going beyond just building the case. And yes, when you build a case, you need to have the evidence behind you. And now more so than ever, we are hearing more and more folks bring up, you know, when people are doing something in connection, behaviors change. We know that in public health, which is where I come out of, that behavior change is essential for prevention of things. And now we're starting to see in the lexicon of social connection, these two issues come together. We see it also in the space of behavioral health and mental health. But what I would love for the future is to see how everyone is saying it, being disconnected is making all other things less effective. And so in the future, it would be wonderful to be able to say, if we include these three metrics or questions in a survey inside of our survey, meaning get the issue of connection to truly be cross-functional across multiple disciplines, and ensure that the issue of connection is embedded now inside of the issue of that disciplinary area. So in health, whatever sector of health, we all speak to things like social determinants of health. It's become a catchphrase. But what's important is we all know transportation, for example, one of those social determinants matters. If you can't get to healthcare, how are you going to get healthcare? But to prove it out, it's not only to defend transportation, it's also to say, yes, that is true. The evidence has borne it to be true because we connected these two trains together and we know. The future for me is that we've connected the trains together on connection inside of various disciplines, whether it's urban development, healthcare, broad economic development, any number of the things that are there, that we isolate a few parameters, embed them across different sectors, and then start to really tell the story of what happens. At the end of the day, the reason why we're here is so that we can connect. While we believe that, we don't necessarily value it at the same level. And putting sharp edges around valuing it, to me, means measuring it well, embedding it in other systems, and ensuring that the financing flows follow. And that would be what that means. Culture and connection can sound soft, but a culture of a disciplinary area means you start making decisions with that in mind. So that's what I would hope would be the culture of connection in the future, is that the culture of different decisions and policy and financing includes connection.